Chronic kidney disease. Chronic kidney disease symptoms preventions. Chronic kidney disease, also known as CKD, is a condition that affects the kidneys and can potentially lead to kidney failure. It's important to understand the symptoms and preventions of chronic kidney disease in order to maintain good health. Chronic kidney disease is diagnosed when there is significant damage or decrease in function of the kidneys over a period of several months or years. Common symptoms include reduced urination, fatigue, swelling in your legs and feet, an increase in blood pressure, shortness of breath, and difficulty sleeping. Many people who have chronic kidney disease do not experience any symptoms until the disease has progressed significantly. Preventing chronic kidney disease starts with understanding your risk factors, such as high blood pressure, diabetes, or a family history of kidney disease. Please subscribe to my channel and like the video. Symptoms. When it comes to chronic kidney disease, fatigue, swelling, and weakness are some of the most common symptoms. Fatigue is a sudden feeling of tiredness that doesn't seem to go away with rest, while swelling can occur in your hands, feet, ankles, and face. Weakness may be a result of poor blood circulation and an inability to produce enough red blood cells, anemia, reducing oxygen levels in the body. As these symptoms are often associated with other conditions such as thyroid issues or diabetes, it's important to visit your doctor if you experience any of them. Chronic kidney disease is caused by a range of factors including age, obesity, and diabetes. However, genetics also play an important role in its development. Causes. Diabetes and high blood pressure are two of the leading causes of chronic kidney disease. Diabetes occurs when your body is unable to process glucose in the blood, resulting in high levels of sugar. High blood pressure is a condition where the force of your blood pushing against the walls of your arteries becomes too strong. Both conditions can damage or weaken your kidneys, reducing their ability to properly filter out waste from the bloodstream. Left unchecked, these conditions can lead to chronic kidney disease, an illness that affects millions around the world. Excess sugar and salt intake, smoking, obesity, and family history are all associated with higher risks for diabetes and high blood pressure respectively. To reduce your risk for chronic kidney disease caused by these conditions, it is important to maintain healthy eating habits and lifestyle choices, such as regular physical activity and avoiding tobacco products. Diagnosis and treatment. Chronic kidney disease is a long-term condition that affects millions of people worldwide. It can manifest in many ways, ranging from mild to life-threatening. Diagnosis and treatment for this condition vary depending on the severity of the symptoms. Blood tests are often used to diagnose chronic kidney disease. The exact cause of chronic kidney disease is not always known, but certain lifestyle factors and medical conditions may contribute to its development. These include diabetes, high blood pressure, and obesity. As with any other chronic illness, early diagnosis and prompt treatment are key components in managing chronic kidney disease effectively. Blood tests can help determine if there is an underlying issue that needs to be addressed before further damage occurs. Prevention strategies. If you're looking to prevent chronic kidney disease, then you'll want to start by focusing on a healthy diet and exercise. Eating right and staying physically active can help reduce your risk of developing chronic kidney disease because they strengthen the body's ability to fight off disease. It's important to keep in mind that while diet and exercise are two of the most effective prevention strategies, it's also essential to be aware of other factors that could increase your risk, such as certain medications or pre-existing conditions. In terms of a healthy diet, eating plenty of fruits and vegetables is essential for maintaining overall health. You should also make sure that you consume enough protein, as this will help protect your kidneys from any damage. Additionally, reducing sodium intake is another key factor in preventing chronic kidney disease. High levels of salt may lead to high blood pressure, which can put strain on your kidneys over time. Conclusion: chronic kidney disease is a serious medical condition that can affect patients of any age. It is important to be aware of the symptoms and take preventative measures in order to protect your health. In conclusion, it is vital for individuals to recognize the signs of chronic kidney disease and take appropriate action towards prevention. Early identification and treatment is key, as this increases the chances of successful management. If left untreated, chronic kidney disease can result in further health complications such as anemia, heart failure, or stroke. A healthy lifestyle, including regular physical activity, limiting alcohol consumption, and consuming a balanced diet, are all ways to reduce the risk of developing chronic kidney disease. Additionally, regular checkups with a healthcare professional are recommended in order to maintain optimal renal function.